Good afternoon. My name is Scott McGann with the Falmouth Health Department. Today's July 10th, 2020. We're doing our weekly COVID-19 update today. Again, the Falmouth Health Department's website is falmouthmass.us. Our email is health@falmouthma.gov. And our phone number is 508-495-7485. We'll do the best we can to get back to you as soon as we can. And that's how you would contact us. And then links to websites with the CDC and state sites are also through the falmouthmass.us website. To jump right in, we've had 204 cases since March 1st. That's up 2 this week. Over 98% of all total cases are no longer in isolation. Falmouth's approximately 13% of all cases in the county, with 14 being expected and our peak being early April, which we were at the beginning of this, somewhere around 23% of all cases. The VNA and the health department locally continue to do the isolation, contact tracing, all that fun stuff. And the CTC, which is the state, working with the state DPH, set up a contact tracing collaborative. They also can help, especially when, with cases that may be traveling and things of that nature. Sometimes you need that sort of state help. So that's where we're at. As far as our map, if you look, we've had 2 this week since the last time I did this presentation on the 2nd. We had 1 the previous week, so our averages are quite low. It looks like since about Memorial Day, we averaged definitely under 10 per week, with the range lately in the last couple of weeks being under 5, which is a lot better than April into early May. We're averaging 20 or between 10 and 20, and earlier on we were averaging up to 40 early on in the event. So again, the case load, at least in Falmouth, is looking good, and also in the state, as we talk about in a second. Total new cases, we can see how the curves flattened out for us. We've had a couple of peaks, again, early April, a little bit with some nursing homes in May, and we've been relatively flat now for probably 6 or so weeks, and that's great. As far as the state, for anybody interested who maybe hasn't heard my presentation before, daily at the state's DPH, just type in COVID-19 dashboard DPH, Department of Public Health. At 4 o'clock, updates the daily counts. If you're from another state, most states do the same thing. We've been averaging, this is about an average day, newly confirmed cases. These are the molecular tests, not the antibody test, 177. We've been averaging somewhere around 150 plus or minus every day. About 25 deaths. Again, deaths are delayed, so these could have been from initial infections that were counted maybe as early as sometime in June. So that takes a little bit of a delay. So our total deaths is 8,053. The amount of tests, we've been averaging around 7,500 to 10,000 per day of molecular tests. We've had over 1 million molecular tests, 1.171180 total number of molecular tests. All our metrics that we're looking at are staying in the green or yellow, in progress or a positive trend, which is great. So that's pretty much similar to what I've been telling you over the last several of these presentations. The metrics that we look at, the percent positive is flattened at 1.9. We wanted it definitely under 3 and then again under 2. And since June 9th, we were at 3.9%. We're at 1.9. We've been 1.9 now for the better part of almost a month, a little under a month, at least 3 weeks. And so that's good news. That remains in a good flat but low trend. Number of hospitalizations is around that 600 range, 650 rather range. But in June 9th, we're at 1,300 on a daily, 3-day average. 3-day daily average. So we remain in a good shape there. Surge capacity sort of remains at sort of 5 or so or less. Hospitals, as they start taking sort of regular things and the different things that a hospital normally wasn't doing in sort of May and April, now COVID cases, they had dedicated wings and dedicated areas that are now being used for the sort of the regular hospital stuff. Now they might have to use surge capacity a little bit more. So you might start seeing those little 5s and 4s when you used to see 1. And it might be just that the hospital's got a lot of regular patients. You add a few COVID patients, you might be bringing it into surge. But that number still remains in a downward trend of since April 15th of down 81%. The death rate, again, early June, we're averaging in the 30s. Late June, averaging in the 20s. Now we're into the teens, and hopefully that trend just keeps continuing, and we're down 88% from April 15th. By county, Barnstable County is 1566. I added, if you look, we've been really flat since May, maybe, I would say that's pretty flat. If you look at the green and the purple, that's Dukes County, which is the Vineyard, and Nantucket County in green, and Dukes in purple. You see a little bit of an uptick because, again, their population just goes up even more than ours does in the summer. So they've had a little uptick in cases, and so hopefully they'll flatten that out relatively quickly. And if you added all three counties since the beginning of July, that's Barnstable, Dukes, and Nantucket, there's been 34 cases. So we have a lot of people here. I couldn't tell you how many people, if you added it all up, in that rate is still hanging at a low. 34 for a 10-day period is pretty good. So the trends are good. Just keeping an eye on that to see what's going on. See if we hopefully don't get an uptick, but we're pretty flat. This is number of residents isolated due to COVID. So this is the number of confirmed cases, 104,000, out of isolation, 94. So that tells us that most of the event is behind us, at least the number of positives so far has been resolved. We currently have 2,586. That's definitely down from last time of currently in isolation. That's down many hundreds from what last week's presentation showed you. So the event, the cases are on the low side, you can have less in isolation. So those are working their way out of isolation. Now this is comparing the states in Falmouth. I put 2 weeks in there. I put in the last one. We had a count of 202. On the 8th, we had a count of 204. Our rate remains relatively the same, around 650 per 100,000. Total tested, we're up about 278 in that 6-day frame, so people are being tested. Our percent positivity is going down because those people are coming back negative, right? So we only had 2 positive, but many tests. And some of those tests might be the molecular ones, and some of those might be antibodies, which antibody tests tell you a previous infection. So the classic, I was sick in February before there were tests. You get an antibody test, it comes back positive. You probably did have it before we even knew it was here, type of thing. So the antibody tests are being utilized, but that's where we're at with that. In the state average, we're 2.5, a little less than 2.5 times, by 2.3 times a lower rate than the state's average. And the state positivity over the last 14 days has been 12.17%. So basically the slide says that we're doing better than the state average. Cumulative hospitalizations from June 26, we're down 187. Our total number of hospitalizations in the state is 635. As far as in ICU cases, we're down 71 from June 26, down to 103. We're down 59 from June 26 to currently intubated down to 42. So, although again, those trends are very, very good. Long-term care, you see the 14 deaths we've had with long-term care, and we've had somewhere around 50 cases or so. The state, 65% of all deaths have been associated with long-term care, and that's where the battle was fought a lot in some of these communities, including ours. From the county, these are some of the local ones. This is from the county website. What I wanted to show here, there's of the 150 deaths in Barnstable County as of July 8th, 103 or 69% are associated with nursing facilities. So that's where the vast majority of the deaths are, and I'm sure you know that it definitely hits the elderly population. As far as getting tested, Barnstable still, again, they haven't switched, still at the 4 Cs, I believe it has not switched over to the hospital yet. I have not gotten a memo of that or a note of that. That's a physician will determine the need for a test and will schedule with the testing center. The testing center, the Cape Cod Healthcare dedicated call center is 508-862-5595. As of June 24th, you can do it at Falmouth Hospital. So again, by appointment, using that number, your physician can make an appointment. So that's one way to get tested. That'll be the molecular test. That'll tell you whether you have active virus. That's an active case, if you're an active case. It's also available at some pharmacies. Last I checked with these CVS last week, or last weekend. The East Falmouth CVS is still doing it. Some walk-in clinics are also doing it, and that would be that's not necessarily with a doctor's note. There's some pop-up sites that are going. The state just announced, I believe this morning I saw on the news, with New Bedford being the closest, 8 cities announced yesterday until now, roughly now until mid-August, they'll be doing a pop-up testing that's free. Just show up, get tested. They've picked some of the areas where they're still above the state average for infections. Lowell, Lawrence, Chelsea, Lynn, Northborough, Marlborough rather, New Bedford, Fall River. Those are the ones that come to mind from the news this week. You can get all that information at mass.gov/COVID-19 testing. You can call the health department. We can help you as well. And so you can get a test. And with 10,000 tests a day, and we want to keep banging out tests. The more testing, the better. We're in for the state as of this week, starting Monday, this past Monday the 6th. We're in phase 3, step 1, which allows gyms and fitness centers at 40% occupancy and face coverings to be open. Museum and some historical facilities and small guided tours. Pro sports without spectators. There's a huge guidance for youth and adult sports. And that one's kind of depends on what the sport is. It's categorized as low, medium, or high. And then there's different steps within the low, medium, and high. And then so that'll continue to move as we jump into steps, whether you can or can't do certain sports. It's one of those what I call popsicle headache regulations. It takes a little time to kind of work through. But there is guidance on that. And if you have any questions, again, you can contact the health department if that affects you. Some human service programs, outpatient types of things, adult day services and things of that nature, therapeutic day services, things like that are allowed to open. Again, everything's got guidance. Some indoor long-term care visitations. And I saw casinos, not that that affects us. So certain things are allowed to be open now in July 6th. There's also a gathering order. It's order number 44. If you want the specific order, you could just put a Google Governor Baker's order number 44, which has an indoor max of 8 people per 1,000 square feet of space, up to 25 people in a single space. Outdoor permitted space was, if there's a permitted enclosed outdoor space, which is like a band shell probably or something of that nature, you're allowed 25% occupancy, up to 100 people in a single outdoor space. Phase 3 is going to last a lot longer than other phases. There'll be other sectors that will be allowed to open in step 2. I would think, with phase 4 being the new normal, means that we would either have a vaccine or a very good treatment, and barring that, then phase 3 would last until that point, so phase 3 could be quite an extended period of time. Actually, this should say last week, New Jersey, New York, and New England states, I think Maine's the only one fighting Massachusetts on this and requiring the 14-day quarantine, but for our purposes, we allow people from the state not to do a 14-day quarantine. It is still an advisory to have a 14-day quarantine upon arriving in Massachusetts from states that are not New York, New Jersey, and New England. And we do get a lot of questions, especially with short-term rentals and the things that we have going here in our area. Now, got a lot of complaints this week with social distancing and face coverings, primarily at the beaches on 4th of July. Of course, we still need to have continued diligence with social distancing and face mask wearing, hand washing, hand sanitizing, not going out when ill, and following all the state guidance that's out there. That's still very important. Even though the cases are low, the last thing you want to do is undo all that work that we've already done. I mean, the good news is we know what to do and what works now, as far as if we do, but we don't want it to happen, so let's just keep diligent. We did get a lot of complaints, and we do follow up. I've been prioritizing the indoor complaints. We did get some calls on the 4th of July. There were some large gatherings on the beach, both during the day and after hours. And the police and town manager, myself, and the beach superintendent, we all worked on breaking up those large gatherings. I guess there was some parties posted on some social media sites that brought large gatherings of, the under 30 crowd to the beaches, and there was alcohol and all that kind of stuff going on, so that was broken up. And we're gonna have to keep working on solutions to overcrowding. Hopefully the 4th of July would be the aberration and not the normal, but we still need to be ready for that to happen if that does happen again. So, and that's stuff we are working on. It's not an easy thing to deal with them. Small, independent. If it's a place on Main Street that needs to have some social distancing complaints, so we can easily go in there. But when you have 953 people sitting in a crowd, then it's a little bit more difficult. But we need to be able to do that. So again, the last thing we want to do is to undo the hard work that everybody's done with social distancing and the sacrifices people have made to keep the counts low. Again, as a recap, the state metrics remain low and flat. Falmouth cases, again, continue to remain low. And our current level in Massachusetts, again, is phase 3, step 1. And if you have any questions, you can call the health department and we'll get back to you. Thank you.